Good morning. This is Dr. Gorav Gupta from Tulasi Healthcare. Today I am going to talk about depression. Depression is a very normal human reaction which is seen in everyone's life, and most of the time it's a self-remitting thing. Normally it lasts 3 to 7 days, and there are mild presentations, and most of the time we are able to remit it on our own. Sometimes it's more severe, where we have serious symptoms like we start getting the sleep disturbance, appetite disturbance, we don't feel like working, we have a hopelessness, worthlessness, death wishes, sometimes suicidal ideation. These kind of symptoms indicate that there is a serious problem, and the other important parameter is the duration of the symptoms. If the duration of depressive symptoms are more than 2 weeks, then it's a clinically significant presentation where we need a professional intervention. If it's a not clinically significant or long presentation, we don't need a clinical presentation. Most of the time we need just supportive talking, or maybe family or friends who can help us to recover these kind of symptoms. Depression is seen very commonly in world, and 3 to 7% of the world population is suffering with the depression. Especially the females are more prone, young are more prone. There are persons who are looking for a career are more prone. So there are certain population which are more prone. Depression is generally two kinds. One is the unipolar depression, where we have the depressive episodes only, and the other kind is the bipolar kind of a depression, where sometimes we get depressed and the other time we get very excited or manicky. Now there is a cyclical pattern, and the treatment of these both the kind of a depression is very different. And it's very important that if you go and visit the doctor, and if you ever had these kind of symptoms in the past, you should clearly express that in the past also you had the similar symptoms of depression or mania, and you need treatment accordingly. Treatment of the depression can be divided mostly into two kinds. One is the psychological treatment, and one is the medical or psychopharmacological treatment. Psychological treatment is where we need to take them up for the counseling, psychotherapy, behavior therapy, and different type of counseling. These type of counseling or supportive psychotherapy can help them to recover. This is mostly a talk therapy which is commonly done in the population, and it works wonderfully well, and it's very effective. The other mode of treatment is psychopharmacological or medical treatment. There are some antidepressants which can be used. These antidepressants take almost 3 weeks time to start acting, and they have to be taken for 6 months to 1 year period. They are not the habit forming pills. See, very commonly my patient asks me this question, that whether they need to take this antidepressant for lifelong matter. No, they are only for short term, and generally once the episode is fine, then we can stop antidepressant with the continuation of treatment for some time, and then stop. Depression is a very common problem, and it's very easy to treat. So please take help, and I wish all the best.